for sickness and death. A premature opening would also cause greater harm to the economy. We must reopen responsibly. Therefore, we are beginning our committee's work with a briefing from public health experts, including 2 former FDA commissioners who served under Republican presidents and 3 other experts whose primary interest is safeguarding the citizens of this great country. But the greatness of this country must be accessible and affordable for all. That is why we need a comprehensive, coordinated, and centralized strategy for faster and freer testing. We also need to deploy proven public health measures like contact tracing, tracking, and surveillance to quickly identify sources and locations. Once we have identified new cases, we must provide necessary treatment in a medically appropriate isolated setting while providing support to patients and their families. These are steps we must take while keeping Americans safe and preventing a second wave, which will cost even more lives and livelihoods. Today, I hope to hear what the federal government should be doing to support and coordinate states and local efforts to safely reopen our economies, rural and urban, in an efficient, effective, and equitable manner. I now recognize the ranking member, Mrs. Scalise, for his opening remarks.
Thank you, Mr. Chairman. I first want to express my condolences to Maxine for the loss of your sister. I know this has touched so many families, some closer than others, obviously yours, so close to home. Mr. Chairman, I do want to thank you for holding this briefing on such an important topic, and that is how do we safely and smartly reopen our country and help people get back to work. Unfortunately, the fact that the House is still not back in session runs counter to the very message that we can safely reopen. This subcommittee, along with the rest of Congress, should be back here in Washington for this briefing. Our job is to help show America that we've begun a path to safely and smartly resume our lives. A virtual briefing unnecessarily sends the wrong message. Congress should be leading the way. We should not be the last to come back. The subcommittee has only 12 members. There are literally dozens of rooms all around this Capitol that are open right now that can hold this briefing safely. With just 12 members, we can achieve model social distancing. In fact, let me show you right now what's going on here. We are in a committee room or a briefing room here in the Capitol. And as you can see, the room is set up with proper social distancing where you could safely have all 12 members of the committee, as well as the opportunity for the public and the press to be here in person. And so I wish we would show that we can do what we're asking the rest of the country to do. The fact that we can hold this briefing in person means that we should hold this briefing in person. President Trump is showing up to work every single day, working for the American people with his team. The Senate, in fact, is here in the Capitol in session today. The United States House of Representatives should lead by example, and we should be here working as well. Put the partisanship aside and let's work together to show America how the rest of this world is responding. Look just around the country. The very first action, though, of this subcommittee was not to help people get back to work. In fact, the very first action of the subcommittee was to attack hardworking blue-collar Americans. I know that the chairman and all the Democrats on the committee sent a letter out literally harassing companies from all across the country that did everything that they were told to do. They were told to keep your workers on payroll. The PPP was there to help those very companies. And in fact, every member of the committee that signed that letter harassing those companies voted for the bill. And so why on one hand would you tell people we want this lifeline out there to help keep people attached to their companies and keep people employed, and then turn around and target companies in the steelworking field, truck drivers, welders? These are the very people we were trying to help. And in fact, they're right now living in fear because if their companies return the money, and I've spoken to these companies, if they had to return the money today after they followed all the rules that we all voted for, they would have to lay off hundreds of workers each. Do we really want to see more and more Americans laid off at a time when we're seeing these unemployment numbers that we're trying to reverse? We're trying to get people back to work. That's the wrong message to send. So attacking blue collar workers is not what we should be doing. We should be helping workers in America get back to work. We really should be holding China accountable for what they did. And unfortunately, that is not happening. That's not what's going on with this committee. And that's a real concern, Mr. Chairman. But each state and local government is starting to reopen. 36 different states have already moved into phase one, proving that you can safely reopen and showing a template for the rest of us to follow. My home state of Louisiana moves into phase one on Friday. I've talked to so many businesses, restaurants, great establishments that are already planning how to safely reopen their business. Let's learn from all of them. Frankly, Congress could be leading the way, showing how to do it. We did it a few weeks ago by safely having a vote here on the House floor, not proxy voting remotely, but actually showing up here to work. We did it once before. We ought to do it again. But each state and local government also must continue to look at the things that we're doing to ramp up production, PPE, and so much of the other vital equipment. Look at all of the progress that's been made already on making sure that we can get more manufacturing into America, take care of our hospital workers on the front line. Clearly, we need to keep that progress going. This committee could help figure out ways to bring some of that work done in China back into the United States. I wish we would focus on that. Maybe we will as we get through this, but it's surely something we want to see focused on. The Trump administration continues to implement the largest relief package in American history. As of today, the PPE's made loans to more than 4 million companies, totaling over $520 billion. That means billions of jobs that are saved, people that are not on the unemployment rolls today because of the work we did in a bipartisan way. Well, let's not taint that by trying to now start targeting those very same companies. Look, we don't live in fear as Americans. Let's recover. Let's work together to get this country back on track. And with that, Mr. Chairman, I yield.
Thank you very much, Mr. Ranking Member. Let me now welcome our panelists. Our first panelist is Dr. Ashish Jha, the director of the Global Health Institute at Harvard University. Next, we will hear from former FDA Commissioner, Dr. Scott Gottlieb. Dr. Gottlieb is currently a resident fellow at the American Enterprise Institute. Then we have Dr. Georges Benjamin, the executive director of the American Public Health Association. Dr. Benjamin previously served as the secretary of Maryland's Department of Health and Mental Hygiene. And then we will hear from Dr. Mark McClellan, former FDA commissioner and CMS administrator. Dr. McClellan is also the founding director of the Duke Margolis Center for Health Policy at Duke University. And finally, we have Dr. Tom Inglesby, director of the Center for Health Security at the Johns Hopkins University Bloomberg School of Public Health. I thank our distinguished panelists for joining us this afternoon. Each will deliver an opening statement of 2 minutes. I now recognize Dr. Jha for his opening remarks.
So good afternoon, Chairman Clyburn, Ranking Member Scalise, members of the House Select Subcommittee. I am honored to join you today. We are at a pivotal moment in this crisis. Our initial response to the pandemic has left more than 80,000 Americans dead and more than 20 million Americans unemployed. As we enter the next phase of this pandemic, we must do better. So one key part of doing better is having a robust testing infrastructure. You see, testing is critical. Testing tells us who has the disease and who doesn't. And testing is the cornerstone of controlling every single disease outbreak. It was inadequate testing that precipitated the national shutdown. We must not make the same mistakes again as we open up our nation. The institute that I run has calculated that the U.S. needs more than 900,000 tests every day to safely open up again. We're doing about a third of that. So how do we do better? While states have a critical role, I believe we need federal leadership. There are 5 key steps that the federal government should be taking. The first, the federal government must have visibility into the entire testing supply chain and use all of its power to ensure adequate testing supplies. Second, and in a related issue, the federal government must coordinate these supplies because different states have different needs, and only the federal government can ensure that states get the material they need when they need it. Third, the federal government should offer guidance on testing strategies because it's not just about having enough tests. It's about ensuring that the right people get the test at the right time. Fourth, the federal government has to ensure adequate incentives for greater investments in more and better tests so that our private sector will know that there is a market for their innovation. And finally, the federal government has to be transparent with the American people about how much testing we need and a roadmap for getting us there. If we act smartly, we can open up safely, allowing Americans to get back to work, knowing that they're safe in their workplaces and safe when they get back home to their families. Too many Americans have already died in this pandemic. We can honor their memories by doing everything in our power to prevent more needless deaths. Thank you, Mr. Chairman.
Thank you very much, Dr. Gottlieb. Dr. Shah, now Dr. Gottlieb.
Thank you, Mr. Chairman. Thank you, Mr. Ranking Member. I think we all recognize the extreme hardship that this nation is going through right now, not just the extreme death and disease from COVID-19, but also the extreme economic hardship and the public health consequences of the shutdown that we've experienced to try to mitigate this pandemic. We all want to start to reopen the economy and get back to the things that we've enjoyed and get back to a sense of normalcy in our lives, but we need to recognize the challenges that we face against the backdrop of a lot of spread that's still persistent in this country. There's hopeful signs. We see hospitalizations and new cases going down nationally. If you look at the 2-week trend, even as we increase testing and we see positivity rates going down, and the doubling time has now extended to 45 days, and the reproduction rate, the reproduction number is probably 1.1 right now. So we're seeing signs of a slowing epidemic nationally, but we're still going to be reopening against a backdrop of more spread than we anticipated. And so how can we do that smartly and prudently and try to mitigate the risk of extended outbreaks and a new epidemic? First, it starts with a prudent approach to a phased reintroduction of work and a reopening. I think it turns on a heavy dependency on case-based interventions, trying to find people who are infectious, ask them to self-isolate, do the traditional tracking and tracing of public health work to try to track down people who might have been exposed and offer them testing. We're not going to be able to get everyone. This is an infectious pathogen, and a lot of people are asymptomatic. But even if we can track down a small percentage or a meaningful percentage of the people who are infected and try to get them into isolation, it can have an impact on the epidemic. Most of all, it's going to turn on testing, as the former panelist just mentioned. And we need to make sure that we get testing out widely and get testing most of all to the people who are at highest risk of this virus. Not everyone's at equal risk of coronavirus. Many people, because of where they work and where they live and how they work, are at higher risk than other Americans. And we need to make sure we get testing into the communities that are most affected by this. Testing turns on technology, and that technology is going to improve a lot in the coming weeks. And we need to make sure that the technology that we apply is fit for purpose. On the one hand, we have rapid diagnostic tools like the Kidel machine that was recently authorized by FDA over the weekend, or the Abbott machine. These are good in doctors' offices. We also have PCR-based.
Dr. Gottlieb, thank you very much.
Thanks a lot.
Thank you. Dr. Benjamin.
Hello, members of the committee. And let me just thank you for allowing me to be here today. I've been saying that now every person in this country now understands that their second job is public health. They're all going to help us get out of this as we return to work and back to our communities. The centerpiece on everything we're going to have to do is about testing, tracing, isolation, and quarantine. We know that our state and local health departments are working diligently each and every day to adequately build up that testing capacity and also to do adequate contact tracing. This is going to be a task that we're going to need the federal government to assist in terms of guidance and help. We also know that we're going to have to address very, very specifically those communities that are most vulnerable. We already know that there are certain parts of our community who are disproportionately infected by this outbreak. Those are people who have public-facing jobs, who have a high incidence of chronic diseases, or who live in underserved communities. We're going to have to actually, at the end of this, think about how we build a sustainable, long-term public health system, and that's going to require federal engagement. So we ought to think about the investments that we're putting into the system today as being long-term, because this is absolutely not the last outbreak of this type that we're going to see. With that, I want to turn it over to you, Mr. Chairman.
Thank you very much, Dr. Benjamin. Now, Dr. McClellan, you are recognized.
Thank you, Mr. Chairman, Mr. Ranking Member, and the rest of the committee for the opportunity to join you all today. I just want to add to the comments that you've already heard. We're in the process of reopening. We need to do that as safely as possible. While testing is not the only thing, it is an integral part of a strategy that also continues to require action by all of us and businesses as we move forward to keep that reproduction rate as close to 1 or below 1 as possible. To give you a sense of where we are in testing now, this past week, the test administered have been between around 2 and 3 million per week. That's significantly short of that 6+ million target that Dr. Jha's work reflects, but a significant increase of where we've been. Based on the administration's expectations about testing increases this month, we should be on track to 3.5 million per week by the end of the month, and maybe 6 million per week by September. So that's a ways off, the kind of numbers that Dr. Jha was talking about. Dr. Gottlieb's written about ways to bring technology in to accelerate the availability of testing. I agree that that can help too. I want to highlight a few other ways to make the tests we have go as far as possible, because right now they are not distributed evenly. We're not testing everyone that meets CDC recommendations for testing with symptoms and testing in high-risk asymptomatic settings for surveillance, but there is more that we can do. One thing is to take further steps to create financial incentives for better and more testing. That includes steps like CMS has taken recently and steps that Congress has taken to add to payments. I think we could do more. Pay more for tests that get better results faster, pay more for tests that are connected to interoperability so that the results can be shared quickly. That's very important for enabling rapid responses. In addition, steps to encourage participation by healthcare organizations in working with that public health system that is very stretched right now. Most states and local governments are collaborating with healthcare providers, including frontline primary care providers, as well as academic medical centers. Those organizations are hurting financially under the pandemic. And to the extent we can link their further payments and supports to collaboration with public health on implementing effective testing and tracing, that will help as well. Finally,
thank you, Doctor.
Is going to play a big role in this work going forward. And I think there are opportunities for collaboration there too. Thank you very much.
Thank you, Dr. McClellan. Now you are recognized, Dr. Ingsley.
Chairman Clyburn, Ranking Member Scalise, distinguished members of the committee, thank you for inviting me to speak with you today. COVID-19 has done great damage to our country, both in terms of sickness and loss of life, and in terms of terrible economic consequence and job loss. To minimize the risk of COVID spread accelerating in a state during reopening, 4 conditions should be in place. Reduction in cases for 14 days, capacity for hospitals to give all COVID patients standard of care, capacity to test anyone with COVID symptoms, and finally, the capacity to isolate cases, trace their contacts, and guide them into quarantine. Isolation and contact tracing have been crucial for countries that have gotten their COVID epidemics under comparatively better control. By identifying those at high risk of getting infected and intervening to stop that chain of transmission. If we fail to contact trace effectively, we'll continue to have new cases appearing in completely unpredictable ways, numbers and places, and our epidemic will grow more quickly. To do contact tracing well, we need on the order of 100,000 contact tracers working for states across the country this year, which is about 30 workers per 100,000 population in a state. As of last week, states have announced plans to hire about 66,000 workers, and 8 states have announced plans to exceed that 30 per 100,000 benchmark. So to close, contact tracing will need to be a key part of our strategy until widespread vaccination can happen. Together with widespread diagnostic testing, strong individual commitment to at least 6 feet physical distancing, cloth mask use in public, and avoiding gatherings. If we do all this work together, we can lower our local and national risks and begin to reopen the economy as safely as will be possible given the great COVID challenges that remain ahead of us. Thank you.
Members will now have 3 minutes to question the panelists. And may I begin my 3 minutes by asking about the testing. I'm a great advocate for mobile testing, mobile units going through our communities. Right now, we have testing taking place. We have stations that people can come to be tested. But the fact of the matter is, in rural America and in some parts of urban America, the mobilization needed is not there. And so I have been a strong advocate for getting mobile units out in these communities. May I have from either one of you your thoughts about mobile testing? Maybe Dr. Benjamin?
Mr. Chairman, thank you very much. That's an absolutely important question, and you're right. My experience, both in the District of Columbia and in the state of Maryland, and talking with my colleagues around the country, is those mobile test vans work quite well. We've used them for immunizations. We've used them for maternal child health. We've even used them for breast mammography. So they work very well, and we should do more of those.
Well, thank you very much. Now, we also know that we are experiencing some unusual numbers coming out of rural communities, low-income communities, African-American communities, and brown communities. Any one of you would like to offer some suggestions as to how we should combat that problem that is beginning to cause some significant angst among too many people?
So, Chairman Clyburn, let me start off by saying this has been an enormously important problem that I think we have paid too little attention to. The disproportionate burden of this disease has fallen on African Americans, on Latinos, and it's multifactorial. But certainly the fact is that those communities, we have not spent enough energy testing proactively, looking for disease in those communities. And then given what we know about issues around access to high quality care, when we don't find the disease early, we end up having people suffering excessively and unnecessarily. So I believe this has to be part of our national strategy to really make sure that we're testing, identifying those cases early, and preventing the disease as much as possible, but then treating it once we've identified it.
Well, thank you very much, Dr. Jha. Now, because I allowed a few of our guests to go a little too long, I'm going to give up the rest of my time and now yield to you, Ranking Member Scalise.
All right, thanks again, Mr. Chairman. And I want to focus on some of those healthcare issues. And if you look, Dr. Gottlieb, I want to ask you, we've seen a number of studies that are starting to come out that talk about the health trade-offs. Obviously, we're focused on COVID-19 and bringing the curve down, making sure our hospitals don't get overwhelmed. And fortunately, that's the case right now in what we're seeing at a lot of our hospitals. But if you look at some of the other things that we're starting to see concerns about, people are delaying some preventative care and treatment, things like mammograms and colonoscopies and even cancer treatment that's not getting done. We're also hearing about vaccinations of children. In fact, Johns Hopkins just came out with a study that estimates 1.2 million children can die worldwide before their 5th birthday, not from COVID-19, but because they're not properly getting vaccinated. And so these are all things we're starting to hear about, too, that don't get put into the discussion as much. Dr. Gottlieb, can you talk about that? Are those things you're hearing or seeing as well?
Yeah, no, thank you for the question. There's no doubt that there's public health implications of the shutdown and what we've undertaken. Now, there wouldn't have been public health if the hospitals were overrun. So we did what we did to try to prevent the epidemic from running out of control. But if you look at the data, we've seen a 90% reduction in prescriptions for vaccinations. A lot of those are pediatric vaccinations or pneumonia vaccinations in senior citizens. Some percentage of those individuals aren't going to go back and get vaccinated now, so we might very likely see outbreaks in the fall of measles and other conditions because of declining vaccination rates. We've seen a decline in people following up for chemotherapy, so people missing chemotherapy visits. There was data put out by Flatiron showing a 17% reduction in follow-up. So we are seeing public health consequences from the actions we took. There's no doubt about that. Now, the alternative was equally challenging because without breaking the epidemic, we really wouldn't have had a functional healthcare system, and there wouldn't have been any public health without a functional healthcare system.
Okay, let me ask you this, because obviously the concern about hospitals is very real. The good news is we're starting to see that decline across the board, including states that have started to reopen. And so here's a case where we don't need to reinvent the wheel. There are states out there like Georgia that are starting to pave the way, and we should all be learning from that, sharing those best practices. We're seeing numbers out of Georgia that show that even with them reopening with a very robust strategy that is using safety, clearly safety is still the driving factor, but reopening from all of the kind of retail establishments you can imagine, they've seen over the last 2 weeks a decrease in deaths and hospitalizations. So not a run on their hospitals, but in fact a decrease. Are you seeing similar things? And as they're reopening, Are you seeing concerns from it? Are you seeing that it's working itself out pretty well?
We're seeing some states that are reopening where we don't see a spike in cases. Florida is another example. But there's some states that are, as they reopen, we are seeing an uptick in cases. But we expected to see an increase in cases as we reopen. So it shouldn't surprise us that cases might tick up slightly as we reopen. We need to keep a close eye, not just on new cases, because cases are occurring because we're testing much more. So we're turning over a lot more cases, but also hospitalizations. We need to watch hospitalizations very closely because that's more of an objective measure of whether or not the epidemic's expanding, albeit a lagging indicator because time to hospitalization might be 5 to 7 days.
But it sounds like they're okay on hospitalizations in states like Georgia. Is that correct?
There are states, the Georgia data, I have not seen an uptick in Georgia. I'm not familiar with the last couple of days of their data, but there are states that are reopening where we're not seeing an uptick. There's some states where we are. But again, it shouldn't surprise us if we do. We need to manage through that. But we expected that as we reopened and as people started to interact more, that there would be an increase in cases. So that shouldn't surprise us if we see that the numbers bump up as we start to reopen.
All right, Mr.
Thank you very much, Dr. Gottlieb. Thank you, Mr. Ranking Member. Now we turn to Chair Lady Waters. And before, let me join our Ranking Member in wishing you our gravest condolences.
Thank you so very much, Chairman. Thank you so very much. All of the members who have sent their condolences. While I'm sitting here, my sister's viewing is going on today in St. Louis. And so many families have been touched. And so I'm hopeful that we can all get together, Democrats and Republicans, and deal with this pandemic. So I'd like to direct my question to Dr. Jha. While the massive lockdowns across the nation have been necessary to save lives, they've come at a tremendous cost on a national and individual level. Americans are eager to return to work, but we cannot continue with life as usual until it is safe to do so. Harvard University, you recently published your roadmap to pandemic resilience, which outlines a course of action for a full remobilization of the U.S. economy by August. The first step in the Harvard roadmap is to implement 5 million tests in the United States per day by early June, increasing 20 million tests per day by late July. House Democrats recognize the need for expanding testing in the CARES Act and fought to include $1 billion to prevent, prepare for, and respond to the coronavirus under the authority of the Defense Production Act. Yet, I have to say the administration spent only 20% of that money on ramping up the production of much needed medical supplies. The rest of that money was allocated by the administration for experimental aircraft, Space Force, and other uses unrelated to the health needs of the coronavirus pandemic. With an apparent but unmet need to fund a rapid expansion of testing, Congress is again taking actions to enhance the nation's medical supplies in the HEROES Act by directing the administration to use the Defense Production Act to spur the production of more tests and testing supplies. And so, let me just say this, we all know what is needed. We've heard from our experts here today. We have a roadmap. It's not about the fact that we don't know, we don't understand, we don't know that we need more testing and more tracing. What we need is the leadership. What we need is, for example, Harvard, when I first was elected to office, we came up to Harvard as new members to learn about how Congress works, to learn about government. Maybe I'm going to ask you and the chairman to think about convening the big conference, the big virtual conference on testing, and bring together the governors to talk about what they need and this administration to understand what is needed by all of the governors and how the coordination is going to take place. It cannot be done with people competing against each other in the states. It cannot be done by having PPE commandeered by anything or anybody. And so the question is not about understanding or knowing what is needed. The question is, where and when is the leadership going to come together to do what needs to be done?
Thank you very much, Chair Waters. No time left for the question to be answered. So we are now going to yield to Mr. Jordan.
Thank you, Mr. Chairman. I want to go back to where the ranking member started our hearing off and asked the simple question, what's the objective? We got 8 different entities currently looking at oversight of the CARES Act and the coronavirus crisis, but we needed this 9th. And I would argue this 9th is political. It's a committee designed to go after the president. The very first witness just 2 minutes ago said it was inadequate testing that initiated the shutdown. I thought the shutdown was initiated to bend the curve to make sure our healthcare system wasn't overwhelmed. But we already got a political statement from the very first witness. This health crisis, maybe the objective of this committee hearing is what the chairman said earlier. It's an opportunity to restructure things to fit our vision. The very first action this committee took to restructure things was to send a letter, as ranking member Scalise mentioned, to send a letter to Universal Stainless and try to put steel workers in Pittsburgh and Ohio, Pennsylvania and Ohio, put steel workers on the unemployment line. You don't have to take my word for it. Connor Lamb and Tim Ryan, 2 Democrats, sent a letter saying, what are you doing to this company with steel workers working there? The second action this committee took, the second act was this unfair hearing itself. Didn't follow the rules, didn't give proper notice, didn't give the briefing memo, didn't give us any witnesses, didn't even ask the Republicans who we might like for a witness. Why? Why did we set up a partisan committee? Why did we have an unfair process? Because I don't think the majority party likes the facts. They don't like the fact that this president shut off travel from China months ago. It was criticized for doing it, but it turned out it was a tremendous decision. They don't like the fact that this president said, you know what, we're not going to send the hard-earned tax dollars of the American people to the World Health Organization, where they lied to us about what China did. I mean, we can probably, I got a colleague who says it best. We don't have to pay people to lie to us, so why do it for free? And yet what did Democrats say when the president made that statement? No. We want to keep sending the hard-earned tax dollars of the American taxpayer to the World Health Organization. We want to keep sending the hard-earned tax dollars of steel workers in Pittsburgh to the World Health Organization. So I'm wondering what the objective is here, because it's an unfair hearing the way we're doing it today via video conference when we should be meeting, as the ranking member said, in a room with the proper social distancing, asking questions, and we're doing it this way. I think it's all partisan. And with that, I yield back.
Well, thank you very much, Mr. Jordan. And with that, I yield to Ms. Maloney.
We are in a war against the coronavirus, and this is the war that we are not winning. We need to do this in a bipartisan way. We need to work together. I thank my colleagues on both the Democratic and Republican side for joining this committee to work together for the answers to protect this country and the American people. We did invite 2 Republican heads of the FDA, and last week the Oversight Committee had a former appointee from President Bush who headed up the response to the Katrina crisis, and he told us in clear words that what we need is a clear command center, a national testing strategy to combat this virus, and that we needed not only that, but we needed to have a Defense Production Act. As we are in a war, activate it, use it, create as many tests as we need, create as much protective equipment that we need. Just get it done. Order it to be done. Get it done, because every expert is saying we cannot reopen. We cannot go back to work. We cannot be near normal until we can test and see who is sick. And everyone should be tested. And this country can do it. We know what the problem is. Let's get out there and do it. We need to test, contain, trace before we can get back to work, which we all want. So my question is to Dr. J. Last week, or rather it was last month, the White House released a testing blueprint. But rather than put forward a national testing strategy, the document provides guidance to states to develop their own testing plans. We've seen states competing against each other for tests and for equipment. He emphasized that it should be centralized. So, Dr. J, from your perspective, does the blueprint that I'm sure you've read provide states the level of federal coordination and support they need to quickly ramp up their testing and reopen our economies?
Congresswoman, thank you for that question. And let me start off just by quickly responding to Congressman Jordan's statement that my opening remarks were partisan. They were not. Every expert on the left, right, and center agrees that we had to shut our economy down because the outbreak got too big. The outbreak got too big because we didn't have a testing infrastructure that allowed us to put our arms around the outbreak. And so testing was the fundamental failure that force our country to shut down. Now, to Congressman Maloney, your question, the national testing outline that the president laid out has some important elements in it, which I support. I do believe ultimately that states have to play a central role in testing. States know a lot about where to test, how to test, but they cannot do it by themselves. 50 states competing with each other in the marketplace. I believe in competition, but this is not where competition is going to be useful. Also, a lot of the supply chains are global.
Dr. Jha.
States can't do it by themselves. Thank you, sir. Sorry, sir.
Thank you very much, Dr. Jha. With that, let me now recognize Mr. Lukenmeyer.
Thank you, Mr. Chairman. The COVID outbreak and subsequent economic fallout is a national and international crisis that is certainly deserving of a dedicated congressional response and oversight. As the president said, we're at war with an invisible enemy, and we must all work together to ensure as many Americans as possible are healthy, safe, and able to provide for their families. Unfortunately, instead of acknowledging that a nonpartisan human health and economic crisis deserves a nonpartisan congressional response, we find ourselves in a committee proceeding eerily similar to those of the House majority forced on the country to endure the months in 2019. This briefing was constructed with absolutely no input from the ranking member and minority whip, Mr. Scalise. Republicans were not allowed to invite a witness, and we were given so little notice that some of us who believe we should be in D.C. for a meeting or the committee proceedings do not even have time to get there. That's my comment. My question is, for Dr. Gottlieb or Dr. McClellan, either one that wants to try it, I think the key to all of this is perspective. And let me just briefly say this. In Missouri, I was on a conference call the other day with the Missouri Hospital Association. We have 4 times as many people who have died this year with flu and pneumonia than we have COVID-19. The mortician in my area here was telling me that he's burying more people due to suicide than he is COVID-19 in our 2 largest counties combined. My caseworker who does Veterans Affairs says she's no longer a caseworker, she now is a counselor. She's talking these veterans off the cliff every day because they no longer have a support network by going to the coffee shop or they can't go walk in the malls. The study is being done by what's happened in New York. 80% of the brain surgeries were postponed. And there's a study back a few years ago that showed for every 1% increase in unemployment, 37,000 people died due to heart attacks, suicides, homicides, and drug overdoses. So, gentlemen, you put yourself in my shoes. I understand your patient concern for folks who are in the COVID-19 situation, and I don't minimize that risk at all. It's there. But the problem is the rest of society has certainly got a health problem as well. When you have people not getting cancer treatments, as you mentioned a while ago, Dr. Gottlieb, brain surgery is not being done. You have mental health, child abuse is up, alcoholism is up. As a policymaker, I have to make a decision. I have to have perspective again on this. If you're in my shoes, how would you make that decision?
This is Dr. McClellan. To start, at least, I've talked to a number of states and governors who are in this similar kind of position. It would be great if we had more testing capacity months ago. I don't think that's enough by itself. It's not a whole strategy for containment. It also requires changes in the way that businesses behave, changes in the way that people behave. All of these are parts of an effective response. So having more testing as you go forward with reopening is really critical. Do I wish we had more capacity in place now? Certainly, but there are other estimates out there, somewhat less than the 6 million per week number that we've talked about so far, that could be part of a comprehensive approach.
Well, my question is this. You're asking me—
I think your time is out, Dr. McClellan.
That's my question. How do you make that decision?
Mr. Chairman, could I answer that question?
I'm sorry. I think the time has expired. We now will recognize Shirley Velasquez.
Thank you, Mr. Chairman, and thank you for holding this important forum. As someone who was stricken by COVID-19, I understand the importance of testing and tracing and taking care of those who are being inflicted by providing the resources that we need in order to make sure that there are more people like me that were lucky to survive this virus. Dr. Jha, consumer spending is at the heart of the U.S. economy, especially for the millions of small businesses operating in retail, hotel, and leisure. Without adequate testing and tracing, isn't it true that many Americans may not feel safe eating out, traveling, or going to work, further harming our already struggling small businesses?
Yeah, so Congresswoman, thank you for that question. You're absolutely right. The American economy resides and is built on confidence. And confidence is decided based on whether people feel safe to engage in economic activity or not. What we saw was well before governors shut down states, people had already started doing social distancing because they didn't feel safe. So the most important thing that the policymakers can be doing is creating an environment where people feel safe to go out and shop and work and play. And testing is fundamental to that strategy.
Thank you. Dr. Benjamin, it is my view that we need a testing system in place that is fast, accurate, and one that can be utilized on large scale. Since we currently do not have a contact tracing system in place, what steps should we be taking to have an effective tracking system to prevent the spread of COVID-19?
I think we need to build that contact tracing system and the testing system on the backs of the existing governmental public health system. It means the investments that Congress has already made and any new investments that we make in that system, we ought to put the dollars in and the training in, and with some significant government at the federal level involvement, both with the Center for Disease Control and Prevention in particular, and the Health Resources and Services Administration can all help us do that.
Thank you. Dr. Gottlieb, just yesterday, an HHS official testified before the Senate and predicted the U.S. will be able to step up 50 million people per month by September. If this is a realistic prediction, given our current testing framework?
Not given our current testing framework, but I think if you factor in new technology that's likely to come onto the market, including point-of-care tests, antigen-based tests, and the use of next-generation sequencing, which I've worked with, I think we can increase the throughput and get to 10 million tests a week. So I think it's possible, but it's going to take additional products coming onto the market and getting authorized by the FDA.
Thank you.
Thank you, Dr. Gottlieb. Thank you very much. I now recognize Ms. Swalowski. Can Ms. Swalowski hear us? Representative Jackie Swalowski, I can see her. Obviously, she's not hearing me. So if someone can work on...
Chairman?
Yes? Yes, Mr. Ranking Member.
Text her. Should she be unmuted? Is she unmuted?
She should be unmuted by
Mr. Chairman?
There we go.
Mr. Swalowski?
Yes.
Thank you. Please.
Thank you, Mr. Chairman.
Thank you.
Thank you so much. I think at the time right now that we should be working together is to defeat coronavirus. I'm totally agreement of that. But I do think it's important for the American people to know that Democrats have continually sought to divide us on this issue. Speaker Pelosi and House Democrats have thrown wrenches into negotiations over and over, pushing for abortion funding and the Green New Deal, while families and small businesses have waited desperately for much needed help and revenue and bridges to hold them together. It's not hard to see the partisan politics at work today. We're here on a subcommittee that was created with only Democrat votes for a briefing that was announced at the last minute unilaterally by Democrats with witnesses selected only by Democrats. This is the tone that's being set. This is crazy. This way has been rolled out. One could be forgiven if this was a mistake, thinking we could just reboot this process. But this is so looking like a partisan impeachment debacle that this country went through, wasting hundreds of hours and multiple millions of dollars of the American people's tax money. The American people deserve better than this. If Democrats were truly concerned about oversight, they would let the already robust roster of oversight bodies do their work. In Congress alone, There are House and Senate standing committees, as well as the Congressional Oversight Commission, the Pandemic Response Accountability Committee, the GAO. That's not to mention all the agency Special Inspector General for Pandemic Recovery, the Department of Justice, and the FTC. The last thing coronavirus oversight effort needed was another committee. But what we do need is a real effort to hold accountable those responsible for this crisis. Last week, Democrats walked away from forming a bipartisan China task force. What did they decide was more important? Bullying American companies for having the audacity to use the PPP loans in compliance with the law to save thousands of jobs for steelworkers, welders, and truckers. At a time when an estimated 100,000 small businesses have closed permanently, Democrats on this subcommittee made it their first priority to try to make it impossible for American companies trying to keep their head above water. Why is that more important than figuring out why Chinese doctors and citizens that tried to alert the world about the coronavirus keep disappearing? Or why the Chinese government is slowing down the international scientific effort to trace the origins of the virus? Or why China is sending counterfeit and faulty personal protective equipment and testing supplies to the U.S. and all over the world? Or why China is trying to hack the very heroes working on a coronavirus vaccine? Or how China co-opted the World Health Organization? The list goes on and on, but the point remains the same. Why do Democrats think it's more important to harass American companies than hold China accountable? Mr. Chairman, I can't help but wonder, where
your time has expired.
What's going to differentiate all these other people? Americans deserve better.
Thank you very much.
Thank you, Mr. Chairman.
Thank you very much. I now recognize Mr. Foster.
Well, thank you, Mr. Chairman, Ranking Member, and our panelists here today. One of our greatest failings in Congress is that we did not exercise adequate oversight over the coronavirus testing in its earliest phases, when it would have done the most good. Instead, we trusted the promises made by the administration about testing, and when these promises were not fulfilled, tens of thousands of Americans have died. I'm not confident that with our current level of social compliance, case isolation, and testing, that we will in fact be able to extinguish this pandemic and get our economy back to normal until we have a vaccine. So one of our greatest concerns on this committee must be to make sure that the vaccine development and manufacturing program is not subject to the same mismanagement, broken promises, and political interference that the testing program was. So my question for Dr. Gottlieb or Dr. McClellan, what are the milestones that we in Congress should be tracking on the vaccine development program to ensure that appropriate plans are being made and executed? In short, that we're not messing this one up too.
Well, I'll just briefly comment and then I'll turn it over to Dr. McClellan. I think the things that Congress can be doing that would be very helpful is trying to focus on running a very parallel process where we can scale up manufacturing and actually start manufacturing commercial scale supplies of vaccines, even in advance of approval, and try to do things in parallel. So do some of the preclinical work and the animal model work that we usually do in a sequential fashion while we're doing the clinical studies, so that we can accelerate this as quickly as possible. So we need what I would call a massively parallel process where we're doing things simultaneously rather than doing them sequentially as we would traditionally do in vaccine development.
You know, just to add, Congressman, we just had a web event that included Dr. Fauci and public and private leaders reinforcing the same points that Dr. Gottlieb made, but emphasize that it's not just about the parallel process of getting clinical testing done, so that clinical trials done, so we know vaccines are safe and effective as quickly as possible, and large-scale manufacturing so that we're ready to use those vaccines as soon as we know, have enough evidence, but also all the materials that need to go along with large-scale vaccine manufacturing, like the vials and the needles. All of this is a big-scale problem that goes along with the research and development.
Yeah, I know. And Dr. Fauci and Dr. Collins published a very good paper in Science Magazine laying out the scientific principles. But what we're after here is the project management principles, so we don't get hooked on the dumb stuff like the reagents and the needles and the syringes and packaging materials. And, you know, this requires competence in just the ordinary part of the program as well as the technical part that, frankly, we haven't seen from this administration. So I'm going to follow up with each of you to see if I can get more meat on that. because we need to know the milestones to track. Thank you, and yield back.
Thank you very much, Mr. Fawcett. We now recognize Mr. Green, Dr. Green.
Thank you, Mr. Chairman, and Ranking Member Chairwoman Waters, my condolences for your loss. I'm disappointed I only get 3 minutes. The committee's not off to a good start. The majority's first action as a committee was to attack American steel manufacturers, job creators. Even their own party struck back on that. Republicans weren't considered or consulted about this first meeting, and we were not allowed to select a single witness. And it begs the question, in fact, it creates some doubt, is the majority really interested in the truth or just pushing a narrative? Congress should be passing bills to help the 33 million unemployed Americans, not creating more committees. We already have 8 mechanisms for oversight. Why do we need another one? Instead of attacking American businesses for their taking the PPP loans, we should be looking at China, their role in this. From day one, China's lies and deception have severely hampered the global response. New data suggests that had China notified the world just 1 week prior, 66% of the lives lost could have been saved. That's 56,000 dead Americans. Because China lied, Americans died. Yet the first action of this committee is to attack American businesses, attack them for actually following the very law that they had just voted to pass. As a physician, we make decisions based on a cost-benefit ratio with the goal of flattening the curve. The costs were worth the benefit. The president closed travel, we shut down the economy, we flattened the curve and saved lives. Now the goal seems to have changed, and it's as if some leaders now want to stop every single transmission. Not one person gets the virus. As a clinician, as an ER doctor, as the former CEO of a healthcare company that ran 52 emergency departments in 11 states, the cost of stopping all transmission of this virus is impossible. The first witness today in answering Chairman Jordan's question said we had to shut the economy down because we had inadequate testing. I'm sorry, that's wrong. We shut the economy down to flatten the curve, to not max out our ICU bed capacity and our ventilator capacity, period. It wasn't an absence of testing that caused us to shut down the economy. We shut down the economy to save lives, American lives, because of the ICU and the ventilator issue. I want to say this. In Tennessee, we're open for business. Georgia's open for business. In fact, they opened April 24th, and they've seen a decrease in hospitalizations and a decrease in cases. Even the chairman's state of South Carolina is doing fantastic, opening up, and they're seeing improvements. The continued cost of a closed economy is also dead Americans. 33,800 Americans are predicted to die because of cancer because of the delay in diagnosis. 75,000 are expected to commit suicide because of the unemployment rate.
Thank you, Dr. Green. Your time has expired. Thank you very much. Thank you, Dr. Green.
Thank you, Mr.
We
Chairman.
now recognize Mr. Reskin.
Thank you, Mr. Chairman. We've lost 82,000 Americans to the coronavirus in less than 3 months. 21 million Americans thrown out of work, more than 1.3 million infections, cases of the coronavirus, which remains out of control in many states in our country. I can understand our colleagues' desperate efforts to distract from the crisis and to talk about almost anything else and to plunge us into partisan conflict. But I appreciate, Mr. Chairman, the leadership you've shown in keeping us focused on the task at hand. Now, I'd like to ask Dr. Jha a question. He points out that we have had this chaotic competition among the states, and we've heard a lot of testimony about how the states have been pitted against each other in this helter-skelter competition for resources and a maze of different laws and guidances and rules, and no one can figure out what's going on. And your colleagues at Harvard, Dr. Jha, have advanced a plan to ramp up testing and to reopen the country safely and sustainably. And your plan says America needs tight coordination of the complex supply chain involved in the logistics to provide the states with the PPEs and the ventilators and the testing kits and eventually the vaccine. You've also called for 900,000 tests a day when we're doing less than a third of that. How do you propose that we actually get to this centralized system of logistical coordination that America needs to get out of this nightmare, given where we are today?
So, Congressman, thank you for your question. I do believe very strongly that states have a very critical role and that states will have a leadership role in this. But the problem is that testing and PPEs, these are national and international supply chains. And so if you have each state vying for the supplies, you will, by definition, have states competing with each other and competing with foreign countries. And while I think our states are terrific, I'm not sure I want Delaware competing with foreign countries in New York and California to try to get the supplies. I think this is why we have a federal government. I think the federal government can play an effective and important role in coordinating, in obtaining supplies, in getting states the help they need, and so that states can focus on the job that they are really good at, which is identifying their own individual needs and figuring out how to best implement a testing strategy.
I want to follow up. Dr. Megan Fitzpatrick at the University of Maryland recently published a study showing that perhaps a majority, but around at least half of COVID-19 infections are caused by pre-symptomatic or asymptomatic transmission. That's a remarkable thing. That means that a half or maybe most of the infections that are taking place occur from people who don't even know that they've got it. What does that mean about the importance of testing, and do we need to dramatically expand testing in the country to deal with all of the asymptomatic and pre-symptomatic infections that are taking place?
Thank you very much, Mr. Raskin. I'm going to have to hold on that answer. Maybe you'll get some time from Mr. Kim. We now must recognize Mr. Kim.
Thank you so much, Chairman. This week, my home state in New Jersey will likely hit 10,000 killed here just in our state. If New Jersey were a country, we would be number 7 in the world right now for deaths. We've lost more Americans than we lost in both Iraq and Afghanistan wars in the 2 decades of that war. I spent my career as a national security official working in Iraq, working in Afghanistan, working under both Republicans and Democrats to try to save these lives. When I talk to the people in my district, they are scared and they're confused. And when they hear our discussions like we're having today about testing and tracing and these next steps, what they have trouble understanding that I hear about is how does this affect their lives? What is this going to do to affect their day-to-day? And when we think about opening up, what are we going to be opening up into? What can people expect? So what we know is reopening businesses and schools, that we're not going to go back to where we were last year, that we're going to be opening up into a new normal that's unlike life as we knew it before. So when we're talking about test and trace and isolate, to what extent do we need to be thinking about some other step of teach or train or something that helps people understand how to embed the public health lessons that you all are telling us into their daily lives? I'd love to hear from maybe Dr. Inglesby as well as Dr. Job just about what steps should we be doing and what role should the federal government or states play in terms of giving advice to businesses and schools and churches and others that right now are asking me questions about what happens next when they start to open up. Please turn it over to Dr. Inglesby.
So Congressman Kim, I think I completely agree with the importance of engaging the public. Certainly in the work of contact tracing, it really needs to be a collaborative effort of people working with public health agencies and respecting the guidance that they get in terms of quarantine. So I don't think that contact tracing, the descriptions of contact tracing should be just for professionals alone. I think the public should be given information about what contact tracing means, why it's important, how it's done, demystify it, and show how it's going to help break the chains of transmission. And on your point about businesses getting guidance, I completely agree. I know that the CDC has been working for some time on developing guidance, very specific guidance for businesses, for schools, for churches, for universities. And I think they're the process about to release that. I think businesses what we are hearing from businesses is they very much want that guidance. They want to be able to tell their own employees that they've met the guidance of the federal government. They want to be able to tell their customers, we've done everything that has been asked of us so that people will feel confidence about going back to work or going back into the economy.
Well, I appreciate that. Chairman, I'll yield back. Thank you.
Mr. Kim, now, let me just say that we set the time frame for this year, and based upon our guests, we did not want to impose upon them. And so I'm going to allow each one of them to take 2 minutes to make closing statements, since some of the things I've said here today, they may want to respond to. Before I recognize Dr. Jha, let me just say thank you to Dr. Green for recognizing South Carolina's successes. One of the reasons we were successful, Dr. Green, is because this Democrat reached out to my Republican governor, and we have talked on more than one occasion about setting up mobile testing. Reached out to the Medical University of South Carolina, the chair of the board, or past chair of the board, Dr. Johnson, and President Cole, and we are working together, not politically posturing, but working together in a bipartisan way. Now, I don't know what the vote was to set up the Truman Committee that we are patterning this committee after. But the Truman Committee, with $1 million, the Truman Committee saved $15 billion. I hope we can have that kind of success with this committee. But we must do it in a bipartisan way, which I'm all for doing. And with that, I'll yield to Dr. Jha.
So again, thank you so much for having me on today. This is a very difficult moment for our country. We are in the middle of the most important and substantial pandemic in a century. I believe that our country has all of the capacity, all of the capability, and all of the innovative energies needed to overcome these challenges. What has been very clear to me from the beginning of this pandemic is that will only happen if we truly marshal all the forces that the country has across the political divide. It's very clear to me as a public health person, as a physician who has spent his entire life taking care of veterans in the VA, and as a public health person who has studied these issues, that the fundamental strategy for getting us through this period until we have a vaccine requires focusing on testing, on tracing, on isolation, maintaining a certain amount of social distancing. And if we do all of that, we can get our economy going again, and we can do it safely so that we prevent deaths and have economic activity. To me, that is not a partisan issue. To suggest that we failed on our first attempt to do this because we didn't have testing, which let the cases get out of control, is not a partisan idea. It is fundamentally the basics of the biology and of this virus. But the bottom line is, if we let science and evidence guide us moving forward, I believe we can have a great economy. I believe we can save American lives. And I believe we can get through the next 12 to 18 months until we have a vaccine that provides much more permanent protection to the American people. So, Congressman, thank you very much for having me on, all the members of this select committee, and I look forward to being helpful if I can in the future.
Dr. Gottlieb.
I think we need to recognize that this is a once-in-a-lifetime pathogen. We need to recognize that what we've done to prevent a worse epidemic has succeeded in many respects, but there's a lot of challenges that remain ahead. And people rightly want to know when this will be over, when they can get back to their normal lives. And the reality is that we may need to define a new normal. There's not going to be a defined end to this until we get better technology in the form of drugs and vaccines. But we need to find ways to try to return to work and return to the things that we enjoy more safely, with greater vigilance than we did before. And there's a way to do that. There's a way to do the things we enjoy and get back to work and reduce risk. It means focusing on at-risk communities. It means working with employers to get testing into work sites. It means trying to take a thoughtful approach to public health interventions like tracking and tracing illness in the community and trying to isolate infected individuals so they don't continue to spread infection. It means investing in testing technologies and getting them out into with the work sites and the communities. And it means focusing on collecting better data about the implications, not just of the mitigation, but also being in a better position to do syndromic surveillance and identify outbreaks in the future more aggressively and more accurately than we've done in the past. And so there's a lot we can do to improve our overall posture. And I look forward to working with the committee on these things.
Thank you very much, Dr. Gottlieb. Dr. Benjamin.
Hi, everyone. Thank you very much again for having me. You know, we're all in this together. I got to tell you, the virus doesn't care. I spent most of my clinical time practicing emergency medicine, and one thing I learned is that if we really work together, we can move this thing forward. We have the opportunity now to start today to do this right. And I just hope that we put the resources in and the organization in and the leadership to get it done. Thank you.
Thank you, Dr. Benjamin. Dr. McClellan?
Thank you as well for the opportunity to join you. There has been some important bipartisan leadership by Congress so far with our response. I hope we can build on that with a comprehensive approach that includes, but is by no means limited to testing or some specific number of tests, but that really focuses on getting people back towards their lives with confidence, getting the economy going again through new steps by business, new public health and healthcare integration, new types of support for innovation in this new reality. This is an unprecedented situation, and I think if we especially focus on what will make things better in these low-income, vulnerable communities, that includes surveillance with testing, but includes a lot of other steps too. Support for helping people be able to stay home from work if they have symptoms, support for getting healthcare organizations reoriented towards working with telemedicine and reaching people at home if they don't feel confident coming out or if they are high-risk individuals. It's a much more comprehensive approach, and glad to be part of the efforts to advance it.
Thank you very much, Dr. McClellan. Dr. Ingleby?
Thank you again for the opportunity to speak with you all today. I have been amazed at the ability of the American people to practice social distancing on scale in order to avoid the kinds of crises that we have seen in China and Italy and in New York City. The fact that we've been able to avoid those kinds of crises around the country, I think, is a testament to leadership and to the American public and the sacrifice that people have put in the last 6 weeks. We have seen other countries succeed in controlling their virus. They haven't been able to eradicate it. That's unlikely, but they've been able to really tamp it down and begin to resume actions closer back towards normal. It won't be normal until we have a vaccine, but they're moving in that direction. We've also seen some states in this country drive their cases down to single digits, and they should really be a model for the rest of the country, and we should try and understand what they've been doing as best as we can so that we can all move in that direction. This is going to be a marathon and not a sprint, and I think it's going to be so important for us to work together in a bipartisan way, in a whole of government way, and the work that Congress has been doing in the last 6 weeks gives me optimism that we can continue in that path, and I think we really need to succeed against this virus. Thanks so much.
Thank you very much, Doctor. Before moving to close, let me yield to our ranking member for 2 minutes for any statement he would like to say in closing. Ranking Member Scalise.
Thank you, Mr. Chairman. And we've heard a lot today in this this briefing. I would just hope that as we move forward, let's make sure this committee focuses on what the stated intent of the hearing was, and that's helping Americans get back to work, helping to reopen our economy in a safe way. This isn't, by the way, a trade-off between economic health and physical health. In fact, states are already doing this and showing how you can have both physical health and economic health at the same time. And I know some of our panelists, our medical panelists, testified to the fact that those states like Georgia are experiencing stabilization in their hospital systems. They're not being overwhelmed. In fact, they're seeing things continue to get better as they're safely reopening. And so you can do both. We have to focus on doing both. But we also have to focus on holding China accountable. If you look at the role the World Health Organization played in this, you had the head of the WHO, Tedros, literally being a mouthpiece for the country, the government of China, He gave out misinformation that hurt the ability for us to stop the spread coming from China. The Chinese government clearly held back our ability to send our medical experts there when their medical experts wanted that. By the way, they've reopened the wet markets, for goodness sake, in China. We all need to be doing more to hold China accountable, to bring that supply chain back, to help Americans get back to work, not to beat up on Americans, but to help them. And if you look at some of the things that we've seen, right now, if you look at some of the questions that were laid out, Americans know what's going on in other states. They're watching and seeing that states can do this in a safe way. Americans are not people who cower and live in fear. Americans confront challenges. We've had challenges before. This is a serious challenge. We've faced every one head on, and we've come out stronger. And so let's use that spirit. America loves a great comeback story. Let's be part of helping this country come back. Not to take a partisan tone, but to work together to get this country back on track and to recover from this pandemic even stronger, so we don't lose those children who aren't getting their vaccinations and those people that aren't getting mammograms. We can help everybody to get back out safely, rebuild our economy, and strengthen the health of this nation. I yield back.
Thank you very much, Mr. Ranking Member. Let me close by thanking all of our guests here today. This has been a great panel. We're looking forward to working with all of you as we try to get our country back up to, well, the new normal. So let me just say in closing, I think Mr. Jordan is correct. There are several other panels working to address this pandemic. And many of them will look into how it started, where it started, and who's responsible. That's not in our portfolio. We're here to make sure that whatever resources we apply to the problem, already almost $2 trillion, and propose another $2 to $3 trillion to make sure that that money is spent efficiently, effectively, and equitably. It is one thing to spend the money. It is something to do it in an efficient, effective, and equitable manner. That is what this committee is all about, and I hope we can work together in a bipartisan way. Remember, Mr. Ranking Member, I said to you when we talked the evening after your members were appointed, that if the distance between me and you on any issue are 5 steps, I don't mind taking 3 of them. Let's work together.
I'll be happy to take the other 2, Mr. Chairman. Look forward to it.
Thank you.
We bought property here in Nelson County in 2003 together with my sister-in-law, and my parents, and we split the property up and built homes next to each other, and we've raised our kids together since 2005. In about spring of 2015, we received the first letter from Doyle Land Services, who was a land agent, telling us they were going to come to our property for a pre-condemnation survey. And if we resisted that, if we didn't sign the letter giving them permission to come on whenever they pleased, they would take us to court and enforce their right to do so. That began our process of learning about how FERC works, how the Natural Gas Act works, how these land services companies work, and about all of the abuses, both administrative